Okay, welcome to the first video for Unit 12, where I'm going to have a look at Assignment 3, which is the treatment of disease. We're going to have a look at some of the key content for the pass criteria, and then I'll do some extra videos in the future for the merit and the distinction, so we can kind of talk you through what you need to actually do. What we're going to do in this video is talk you mainly through the methods for treating infectious disease. So I'm going to identify those with you, and we're going to describe how each of them actually work. So just to start, what I'd like to do is pause the video and just list methods for treating disease that you know of. So do that now. Okay, so hopefully you've now got a list of methods for treating diseases. It could be quite a big one, it could be quite a small one. It doesn't really matter too much. Here are the key ones that we need to be comfortable with. A lot of these you'll have heard of. So I'm not going to read them out. You can read them yourselves. What I'm going to do in the next couple of slides is just talk you through how each of these essentially work. And then you're going to pick one to do for your assignment. Okay, so what we're going to do to start with is just focus in on antibiotics. And antibiotics, obviously used for treatment of bacterial infections. There's quite a broad range of antibiotics, and some of them are broad in their nature in the sense that they will work on a wide range of different bacteria. Some are very narrow in the sense that they will only act on a small number of bacteria, perhaps even just one strain of bacteria. What we are interested in is how they actually work. And they kind of target bacteria cells in three groups of ways. The first is to disrupt the reproductive process. And this is actually done either in one of two ways, is either to inhibit the nucleic acid synthesis, so preventing the synthesis of DNA. And this in turn stops the bacteria from reproducing, or it can disrupt protein synthesis, and this in turn can prevent the bacteria cell from growing and also from reproducing. The second way it can work is by disrupting energy processes or metabolism, so the way that the bacteria is able to break down nutrients to release energy, and in turn this can cause the bacteria essentially to become inactive and die. It's quite a handy way of killing any bacteria. The third way is by disrupting the cell wall production and the synthesis of the cell wall, making it weaker so that when the cell takes on any kind of fluid, it could pop and lyse, essentially. So lysis occurs, and this actually kills the bacteria. So what we actually find is that antibiotics work in one of two ways. They're either bactericidal, in the sense that they kill the bacteria, or they're bacteriostatic. And what this means is that the drugs stop the bacteria from growing and reproducing. And these particular bacteriostatic ones essentially work by stopping the bacteria colony from forming inside the patient, and then allowing the immune system chance to go in and to destroy the remaining bacteria that are there. Now, if you're going to look at antibiotics, it'd be worth considering something called antibiotic resistance, which I'll cover a bit later in the course, perhaps in another video, which will cover the distinction criteria, where you start to evaluate the treatment options available. And resistance is a growing issue, as it is also with other forms of treatment as well. So what we're going to do now is we move on to antivirals. So antivirals are obviously therapies to stop viral infections. Now, viruses require a host cell to reproduce. They do this by entering into the cell and hijacking the nucleus and the DNA and telling the cell to reproduce parts of the virus, which are then packed and assembled by other parts of the cell before these viral particles are then shipped off to other parts of the tissue. Now, antivirals essentially look to hijack this process and to disrupt the reproductive process of the virus particle. And they tend to do this successfully by targeting key enzymes in the cell. So perhaps, for example, reverse transcriptase, which is an enzyme that is important in the reproduction or the production of proteins. The antiviral drugs are quite good at targeting those particular enzymes and stopping the virus from reproducing. They don't actually tend to kill the virus. What they tend to do is reduce symptoms. But this in turn, this reduces the number of viral particles inside a patient and can reduce the infectivity of a patient. And and therefore make them less able to pass the disease and transmit that disease to other people. So quite an interesting group of therapies there if you want to pick that particular one. Going into a bit more depth within antiviral drugs, there are a group of drugs called antiretrovirals, and these are essentially drugs used to treat things like HIV. So retrovirus is a virus that's responsible for HIV. This particular group of therapies essentially work by preventing the entry of the virus particle into the cell. So they're entry inhibitors. And you can actually see this in the image. So at the top where you've got a virus particle trying to bind onto the cell surface, and there's a little cross, and it says entry inhibitors. So this particular drug will prevent that virus particle from attaching to the cell and being taken into the cell. And if it can prevent the entry, it can actually prevent the reproduction of that particular virus. Some of the others, and further down in the image, you might see other crosses. There are 3 other crosses. This is where the antiretroviral drugs are inhibiting key enzymes again. So that's another key way of preventing viruses from emerging in the body. Now, if we stop this kind of treatment, what we tend to find with antiretrovirus drugs is they need to be given over the lifetime of a patient, perhaps every day. And if we stop this, the virus can re-emerge and the patient can relapse, which is an issue. And it does make treatment potentially quite costly and quite time-consuming in that sense. Now, if we move on to antifungal. Antifungal drugs work on fungal infections. Now, fungi, they have a cell wall structure and a cell membrane structure. And both of these two structures can be attacked by antifungal drugs. The cell wall structure itself contains something called glucans, and glucans are a polysaccharide, like a sugar, that essentially gives that cell wall its structure. Some antifungal drugs can actually prevent the production of these glucans, and it can actually cause the cell wall to become weaker, and this in turn can cause the fungal cell to die. Other antifungal drugs can cause leakages in the cell membrane, and they do this by attacking these substances in the cell membrane, which cause essentially pores to form in the cell membrane, and that allows fluid to exit the cell and essentially can cause the cell to lyse or split open. There are another group of antifungal drugs that disrupt the reproductive process, and they do this by inhibiting DNA synthesis. If we can inhibit DNA synthesis, we can actually prevent the reproduction of that particular pathogen inside the body. Okay, so that's antifungal drugs. What we're going to look at now is the antiprotozoal. And the antiprotozoal drugs include antimalarial therapies, including chloroquine, which you may have heard of, touted as a potential drug to treat the coronavirus. And there's no real evidence for that just yet. But chloroquine is used to treat malaria, essentially. And what we tend to find with protozoal infections is they require really specific drugs to treat each and every protozoal infection. But they all tend to have the same action. So the antiprotozoal therapies tend to disrupt DNA replication. And that's kind of, again, a common theme. They do this by inhibiting key enzymes that cause the DNA to replicate. And if we can prevent that DNA replication, we can therefore prevent the pathogen from reproducing and allow the immune system to come in and attack and kill that particular pathogen. Moving on to this one. So this is the Antihelminth. And the helminths are a group of pathogens which include things like worms, flatworms, for example, or nematodes. And these are parasites, essentially, that sit inside your body and they consume your nutrients and they make you feel quite ill. Now, nematodes and flatworms, they are fairly straightforward in terms of the way we can attack them. We can attack them using toxins, and we can basically fill the body with small doses of toxins that essentially do one of two things, and that's either kill the worm or the nematode or expel it from the body. And the image shows just a couple of ways in which this can happen, and it gives you some examples of those drugs as well. So they either disrupt the nervous system or they can disrupt the uptake of glucose, and that can actually kill the helminth inside the body and can stop that from happening. Okay, so the next one up is rehydration therapy. Now, rehydration therapy is generally used to treat the symptoms of severe diarrhea or dehydration, essentially, that's caused by things such as cholera. Now, the rehydration therapy itself is quite simple. It's just a powdered mixture of salt and sugar, and it should be mixed in with clean, sterile water, and you give it to the patient. Generally, it's given orally. Some rehydration salts can be given intravenously as well. And they just act to replace the fluids, but they also replace the salts and the sugars that are lost directly from the blood supply when bacteria such as cholera get into the gut and they cause fluid to be lost from the bloodstream, and that's what is causing the diarrhea. These are quite inexpensive ways of treating people, and they can be quite effective as well. So again, another one that's worth possibly looking at. But what you're doing there again is you're treating the symptoms as opposed to curing the actual disease. This next one is quite an interesting one. Immunoglobulin, or antibodies, are a treatment given generally to boost antibody levels. So what we are actually doing with this particular therapy is we're intravenously inserting antibodies into a patient, and this requires blood plasma donations from a previously infected patient. And this can be quite useful if you have an immunocompromised patient, and you can introduce the antibodies to a sufficient level at which they start to attack a pathogen. Now, these are obviously very specific. Antibodies are specific to a pathogen. And this is quite a complex means by which to treat a patient, but it can be quite useful if we don't have any of the other treatments that we've already discussed. So again, it could be quite worth looking at. There's quite a good amount of research into this particular area. Now, all of these drugs can be given in a number of different ways. It's worth making sure that you include this in your assignment. So we've got either oral, so that could be a fluid or a tablet. Intravenous, so this is directly into a vein. Intramuscular, so that again, it depends on what's being administered. Or there's topical administration. This is where it's applied directly to the skin in that particular sense. Now, what you really need to know is how this relates to the assignment. So what I'm going to kind of go through here is just really quickly talk you through what you need to do next. So what I'm going to suggest is you pick one infectious disease. So cholera, tuberculosis, malaria, any of those. Just one. Don't try and be clever and pick more than one. You just need to do one. Name the pathogen that causes the disease, and just give a bit of an overview of the actual pathogen and the symptoms that it causes. You don't need to go into much depth there because that bit is not graded. Once you've done that, talk to me about how the treatment is delivered to the patient, and then move on and talk about how the treatment actually works. So you're going to need to do some research there. You're going to need to think about how that particular treatment is acting inside the body. Is it preventing the enzymes from working? Is it stopping DNA synthesis? Is it acting to actually kill the pathogen, or is it just treating the symptoms? And that's going to be quite important in terms of what you're talking about. Now, within this description, it's going to be quite important to include a discussion around the time period and the duration, and how the treatment actually acts within the body. And if you can include those bits and pieces, that will hit the pass criteria really nicely. Okay, so what I'm going to do at this point is I'm going to sign off. I will do some more videos if you think these are useful, so give me some feedback. This is all covered in the Google site, and it's on the assignment brief in the classroom as well. If there are any issues, just drop me an email. Thanks very much.